Welcome back to Biochem 2. We're going to look at Chapter 11, the water-soluble vitamins. So this chapter, there's a fair amount of reading, and it's going to kind of bounce around a little bit. I got a lot of information that is pretty memorize-y, if that makes sense. So, objectives for this, we're going to describe the functions of the water-soluble vitamins. So we want to know functions, we want to know the sources, what foods they come from, the dysfunctions, diseases, signs and symptoms, if we're deficient or we have excess of these vitamins, describing those chemical and physical properties, so what do those vitamins actually do, what are they responsible for, as well as their recommended dietary allowance, so how much we're supposed to have per day. These are the specific vitamins in the diet, which they have different diseases. We're going to come back to this. I think it's easier to tackle them all one-on-one as we go through the vitamins, rather than try and just look at this whole list now. Just a general note, we can avoid vitamin deficiency by eating a wide variety of food and having an adequate and balanced diet with those leafy vegetables, fruits, grains, etc. So the B complex vitamins, biggest thing, our B vitamins are a good chunk of our water-soluble vitamins. So the ones that we have, remember, are mnemonic. Tall, rich nudists played pickleball for centuries. That is B vitamins 1, 2, 3, and 5, 6, 7, 9, and 12. So we'll look at our B vitamins. Other one, I believe the only other water-soluble one that we're really going to focus on is vitamin C. Okay? So, the vitamin B complexes are cofactors in enzymatic reactions. I believe that is a typo. As far as we have learned it, the way that we always talk about it, coenzymes are our vitamins, cofactors are our metals. I think that just like the pure definition versus biochemical definition were kind of mixed up here. So in most cases, if you have to choose between saying cofactor or coenzyme, pick coenzyme, because vitamins are coenzymes more often than they are what we would call cofactors based on the definition stuff. So just a little typo there. The characteristics of the vitamin B complexes, but vitamin B complex is just saying the B vitamins. They are water soluble, so any excess of these vitamins are excreted in urine. I want you to think about real world application. If anybody has ever drank an energy drink, any kind of like 5-hour energy, anything like that, if you look at the actual label of it, it'll say something like 3,000% of your vitamin B12. And the reason why you can essentially what we call macro dose the B vitamins is because they're not going to accumulate in the body. Okay? We don't need we're not really it's very, very, very difficult to overdose or to have any kind of toxic reaction to B vitamins as long as our kidneys are functioning, because as soon as we put them in, they absorb into the bloodstream. The kidneys are if there's excess, the kidneys are going to filter it out, and it's just going to leave our body, be excreted in the urine. So again, most of the time, I don't think we ever really talk about like we saw up here, talking about the vitamin deficiencies and excess conditions. We never really talk about excess of B vitamins. It's not that important. We're almost always tested on the not enough B vitamins, which is also one of the reasons why we need to consistently replenish B vitamins in our bodies, be consuming B vitamins, because we don't store them very well in our bodies. Apart from cobalamin, which I'm sure we will see later on. So vitamin B1, our tall in our mnemonic. Vitamin B1, aka thiamine. You will know its active forms. We'll get down and read about the active forms in a minute. But some of the sources of our thiamine is cereal grains, meat, legumes, so all of our beans, green peas, lentils, those kind of stuff, as well as fruits such as oranges and grapefruits. Certain raw fish contains a heat labile enzyme thiaminase that destroys thiamine. So if you eat a lot of raw fish, you can prevent thiamine absorption. Heating and general food processing also destroys thiamine. So the active thiamine is thiamine pyrophosphate. So these are going to be important. A lot of your questions are going to come from active forms. So you'll have what the B vitamin is, what's its active form, what reaction does it do, and then also kind of what is the disease deficiency, or like the things that you will see with that vitamin deficiency. So the active are thiamine pyrophosphate or thiamine pyrophosphoric acid. Another name for this one is, we've seen it before, TPP. So thiamine pyrophosphate, thiamine pyrophosphoric acid, TPP, which serves as a coenzyme in enzymatic reactions, transferring an activated aldehyde unit. We talk about aldehyde unit. The way that I know, let me see if it says anything else about this. We'll keep reading, and then I'll come back and give you kind of the more generalized terminology of this kind of stuff. See if it talks about it first, though. ATP-dependent thiamine pyrophosphokinase, also known as thiamine diphosphotransferase, is present in the brain and the liver. This enzyme is responsible for the conversion of thiamine to its active form, the thiamine pyrophosphate, or TPP. Thiamine is absorbed by the intestinal mucosal cells, so it's absorbed in the intestines and transported by a thiamine transporter protein into the mucosal cells, where they're converted to TPP, and then leave the intestinal mucosal cell by a sodium-dependent transport mechanism to the circulation. I don't recall exactly what specific kind of questions they're going to ask, if any, from those kind of extra little tidbits. So when we do the Linus Learning questions, watch out for that kind of stuff. Or if you watch the Linus Learning questions after this, kind of pay attention to what extra little details they want you to know. Thiamine monophosphate, also known as TMP, coming mainly from the diet, is converted to thiamine catalyzed by a phosphatase enzyme. Thiamine is then transported into the cell and is phosphorylated by phosphokinase to produce the active form, thiamine pyrophosphate. TPP is then inactivated by adding one extra phosphate by synthesizing thiamine triphosphate, TPPP, which is catalyzed by an adenylate kinase. A lot of extra information and stuff there. Essentially what you want to know, we get adding phosphates, so TMP, you get phosphatase, you get thiamine, then a phosphokinase, and then adenylate kinase, to turn it to inactivate it by turning it into the triphosphate. So adding in here a phosphokinase activates, adenylate kinase inactivates, and so on. Biochemical enzymatic reaction that use thiamine pyrophosphate as a coenzyme. So 2 types of reactions, and all these reactions are inhibited when we are deficient in thiamine, which makes sense. If we don't have thiamine, then we can't perform the reaction. 2, we have oxidative decarboxylation of alpha keto acids. Big fancy way of saying we take off that CO2. So a lot of those reactions, when we think about Krebs cycle or glycolysis, anytime where they were pulling off carbon dioxide, that is going to be our B1 thymine. Alpha ketoglutarate dehydrogenase enzyme, that alpha ketoglutarate from that Krebs cycle, the dehydrogenase enzyme oxidatively decarboxylates alpha ketoglutarate to form succinyl-CoA. There's just that example. TPP is one of the required enzymes along with other cofactors such as NAD+, FAD, lipoate, coenzyme A. This is just describing that reaction within that Krebs cycle. Anywhere that we see Krebs cycle, pyruvate going to acetyl-CoA, again, we see carbon dioxide coming off of that. This would be acetyl-CoA plus CO2. Anytime we see, carbon dioxide coming off, that's going to be our thiamine, our TPP. Also trans-ketolase reactions for interconversions of sugar phosphates. So this is what you're going to want to remember. If you're making a chart, a little graph, these are the things that I would make sure that you add. So kind of the name of the B vitamin, like its general name, what its active form is, as well as its reactions. For example, xylulose 5-phosphate plus the erythro 4-phosphate converting to glyceraldehyde 3-phosphate and fructose 6-phosphate. These are just some of those reactions, a couple of other reactions. They're not going to, I don't believe he's going to test you aggressively on this. If he does, more than likely he'll give you what the enzyme is, and you should be able to tell based off of that it's a trans-ketolase reaction, and be able to answer the question there. So big, super, super important as well. This whole chapter is going to be heavily tested in the future in many different courses. Pathology courses, your clinical nutrition course, on boards. There's always questions. The biochem section of boards, as well as the microbiology section and the general pathology section, all have questions that come from the B vitamin stuff. So thiamine deficiency produces a disease known as beriberi. Beriberi. So it's caused by a carbohydrate-rich diet with low thiamine. For example, polished rice or other refined food sources such as sugar and white flour. If he repeated the same activity, this was what you guys did recently as like a little 5-question group thing, talking about how in places like in Asian countries where they eat a ton of rice, especially like the polished white rice, they had to start adding thiamine powder. This is kind of where the big debate, do you wash your rice or not, kind of comes from, where they say, hey, wash your rice until it runs clear. But really, if you're eating a diet very high in white rice, and it's kind of the only grain, and if you're eating like a low meat diet, you're actually washing off. A lot of companies, what they do now is they add thiamine powder into rice in order to prevent thiamine deficiency. So wash your rice, don't wash your rice, depends on what you decide. So the thiamine deficiency conditions are generated due to an inadequate intake of thiamine. So diets largely depend on milled, non-enriched grains such as rice and wheat, so those heavy processed, those white bread, white rice. Ingestion of raw fish containing thiaminases, tea containing anti-thiamine factors that blocks the action of thiamine. Chronic alcoholism causes impaired absorption and storage of thiamine. Long-term renal dialysis for patients or those undergoing intravenous feeding. And then thiamine-responsive inborn errors of metabolism. Most of what you'll be tested on is this first one, either an inadequate intake of thiamine or the chronic alcoholism. You will see the chronic alcoholism. It has a specific name. You'll hear a ton about this as you go through the program. It's called Wernicke-Korsakoff syndrome, which can be a fatal condition if not treated. This is for somebody who, when you're drinking large amounts of alcohol, essentially you're unable to absorb and to process thiamine due to the alcohol that you're drinking in the intestines and throughout your body. And so what will actually happen is, especially people who are coming off of in recovery from alcoholism, will often present with something like Wernicke-Korsakoff, and it can be a very, very serious condition, essentially because your body is unable to do some of these general processes. Remember, so taking off that decarboxylation reaction, which we need for glycolysis and going into the Krebs cycle. So if we're not able to convert to the Krebs cycle, we can't produce ATP. Cells start to die. So you'll see that. I don't know if you'll see it in this test or if just in the future, but we'll see if we find it through the book as we keep going. Symptoms of thiamine deficiency, you'll see mental confusion, muscular weakness, paralysis of the motor nerves of the eye, muscle wasting, peripheral paralysis, tachycardia, or enlarged heart. So these are the kind of things you should be writing down. This is perfect material for flashcards. Like, honestly, throw up the deficiency, put all these in there, and say, what B vitamin is this? And run through flashcards a lot. Because like I said, this is pretty memorize-y. The recommended dietary allowance. From what I recall, this is not really tested on. Don't waste your time memorizing all of this. What I would say is give rough estimates. So like kids, about a half, adults, around 1, if you're pregnant or lactating, a little bit more than that. So 1.1 to 1.2 milligrams per day per adult, so around 1. So don't try and memorize these whole charts, okay? It's not a good use of your time. Next is riboflavin. In our mnemonic, rich. Tall, rich. So riboflavin, thinking about these are going to be our the flavin nucleotides. These are our FAD, FADH2, that flavin mononucleotide, FMN or FMNH2. These guys. Riboflavin is converted to FMN by flavokinase. Some of these enzymes, just know what the enzymes are. Again, when we look at the Linus questions, we'll get a better idea how specific he'll be in with these. But again, most of the questions are from the name, the active form, the reaction, the deficiencies type stuff. So, When FMN is converted to FAD by the addition of adenine group coming from a second ATP molecule, it's catalyzed by FAD synthetase, and the cofactor is magnesium. So, might be a good point to pick up. You need magnesium with riboflavin. Another little just kind of separate tidbit. Oftentimes magnesium is a cofactor that we're very deficient in, especially with mental illnesses. So stuff like depression, anxiety, those kind of conditions, bipolar. So a lot of times, along with, if you have one of these conditions, a lot of mental health professionals will recommend starting with a magnesium and vitamin D supplement. Of course, this is not medical advice. Just saying, if you, myself personally, and my wife, when she was dealing with some of this kind of stuff, that was one of the first steps that we took towards trying to help with that, is just that supplementation. So if you're dealing with some of that, talk to a mental health professional about it, and see if it's something that they recommend. The functions. All of these guys serve as a prosthetic group of the oxidoreductase. Hopefully we remember what FAD, FADH2, all this kind of stuff does, because our FADs are going to take the hydrogens, FADHs, FADH2s. We're going to give those hydrogens. They're the flavoproteins. Many flavoprotein enzymes contain one or more metals. Flavoprotein coenzymes undergo reversible reduction, so they help with the oxidation reduction reactions, as well as here's just some of the examples of those oxidoreductase reactions. They also do assist with some of the dehydrogenase. You call them dehydrogenase reactions or enzymes. Remember that the dehydrogenase enzymes are those oxidoreductases. So anytime that you're looking to figure out, okay, what is going on, look for the enzymes that are our dehydrogenase reductase, these guys. If there's a dehydrogenase or a reductase, that's what you're going to be looking out for. This way, don't memorize each of these individual enzymes. Just remember dehydrogenase or reductase. So the foods: milk, eggs, meat, liver, green vegetables, and cereals. Heating, food processing, exposure to light destroys this vitamin. Most of your B vitamins, a lot of them are going to come from animal products. So keep that in mind. Animal products are typically, the animal products, and then the enriched grains are most common. Riboflavin deficiency. So deficiency diseases, usually in combination with other B vitamin deficiencies, such as the thiamine, B6, or niacin. One that I don't believe he mentions here in the book, I'm not sure if he mentions it in the reading or in the actual lecture, you will get something called chelosis, and this is a cracking in the corners of the mouth. I have a picture of it that I can pull up. Yeah, if you're squeamish with medical pictures and stuff. So here, this is chelosis, kind of that cracking at the edge of the mouth. You can also get something called a magenta tongue. So you have kind of the tongue. It's called. You can get this with a couple different ones. Most often it's associated with riboflavin. You get a magenta colored tongue. This you probably won't be tested on. Chelosis, you might be. But yeah. And this for sure, 100% on boards. Definitely tested on. So the chelosis, like the technical term, another technical for the chelosis is angular stomatitis. Again, you don't need to know all of this. I'm just going to introduce these words to you now, so that way, you have you see them for the first time now. Some of the causes of riboflavin deficiency: inadequate intake of protein or green vegetables, as well as alcoholics. You'll see that's a common theme. Alcoholics inhibit absorption. The symptoms: you'll get stunted growth, seborrheic, so secretion of fatty or oily fluid. You get dermatitis, soreness and burning of the lips, mouth, and tongue, photophobia, burning and itching of the eyes, as well as neuropathy. That seborrheic, this is most commonly what they test on. Like I say, it kind of fits with that chelosis. Same thing with the RDAs, around 1 for adults, around 0.5 for children. B3, niacin. This is our nudists. Let me look and see how we're doing on time. Okay, we'll get through this one and then start a new video. So niacin is a pyridine derivative. Niacin is also synthesized in humans from the amino acid tryptophan. That'll most likely be a question because it fits with the previous chapter, 2 chapters ago. Nicotinic acid is first phosphorylated by phosphoribosyl phosphate to form nicotinate mononucleotide, followed by its conversion finally to nicotinamide adenine dinucleotide, NAD+. We've seen NAD+ many times. Adenylation is caused by donating the adenyl group from ATP, and amido group is derived from glutamine. All of our active forms, as you can see, you'll want to remember these active forms for like their abbreviation, but you also want to remember the name fully spelled out or fully written out, because that's an easy way that teachers will try and trip you up, is just give you the full name instead of just NAD. The function, so it's essential for synthesis of coenzymes. One group of oxidative reduction enzymes can utilize either the NAD+ or NADP+. Another group of enzymes utilizes only NAD+. The third group of enzymes utilizes only NADP+. Don't think that they really go into that. Main idea, we're thinking NAD, NADH. Biggest thing that we're looking at with NADH is going to be energy production, ATP production. The whole point of glycolysis and of the Krebs cycle, electron transport chain, is using NADH to transport those high energy electrons to produce ATP. So if we don't have what we need, that NAD, the niacin, to create NAD, then we're not making ATP. So very difficult. So again, it's very similar to riboflavin. FAD and NAD have similar jobs. Think of those oxidation reduction reactions, dehydrogenase and reductase type enzymes are going to need our NAD, NADH, those guys. We get vitamin B3, meats, legumes, peanuts, enriched cereals. Commonality, meats, legumes, those cereals. And same as the other ones, heating and general food processing reduces the food content of niacin, even though niacin is fairly stable. This is why, in general, the more processed the food, the lower the nutritional value, because the actual processing and cooking of food does destroy vitamins. It's better, if you have fresh food, cook it yourself. Different cooking techniques, so stuff like steaming food is better for it versus boiling. Boiling tends to, a lot of the vitamins and nutrients tend to actually seep out into the water. So if you're not making like a soup or something with it, if you're just like boiling potatoes to turn them into mashed potatoes, you tend to lose like some of the vitamins and minerals that are part of that. Causes of niacin deficiency: inadequate intake of protein or green vegetables, again, alcoholism, tryptophan and niacin deficient diet, niacin deficiency. Right here, pellagra. Pellagra is what you're going to see in these kind of patients. Usually we call these you get the 4 Ds. The ones that I have always learned are dementia, diarrhea, dermatitis, and death. Because again, if we don't have NADH, we can't produce ATP, therefore we die. So this has some of them: dermatitis, dementia. Add in the diarrhea and death part of it. Very, very severe. So what does this say? Use of large doses of nicotinic acid, but not large doses of nicotinamide, can cause release of histamines and prostaglandins. Prolonged use of large doses may produce gastrointestinal irritations, cause liver damage, stimulation to the nervous system. However, these effects are unrelated to the vitamin functions of niacin. Yeah, don't worry too much about that paragraph. These guys: dementia, diarrhea, dermatitis, death, weight loss, all of these stuff. Digestive disorders, there's the diarrhea. RDAs, again, don't worry too much about the RDAs. It's just a lot of, he's not going to ask questions or many questions about that just because it's super pointless specific memorization. Okay, we're going to go ahead and stop this video here, and we'll continue on with the next one. These are going to be a little bit longer, guys. I know it's not actually a ton of information that you actually specifically need to know, but it takes a while to kind of get through it for when you're looking at it for the very first time. Okay, I will see you in the next one.